Welcome to the Chairman's Perspective Podcast.
Welcome to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today on our show we're going to have Dr. Altha Stewart, Senior Associate Dean for Community Health Engagement at the University of Tennessee Health Science Center. She is also nationally and internationally known as the former past president of the American Psychiatric Association. Today we're going to do part 2 of a special series called Mental Health and Coping During COVID-19. Tune in to the Chairman's Perspective. We're going to be right back here on the KUDZUKIAN Network.
Are you telling me that Jesse Jackson couldn't brush his shoulders off?
Welcome to Funky Politics, Brother Cornell Belcher. How are you, sir?
I'm honored to be a part of Funky Politics. America's not going to fail because of some outside army invades us. No, America's going to fail because of Americans can't get along.
Now is not the time to hate or criticize. Now is the time to disinfect and deodorize. Like the incense, it's going to be funky because this is one funky show.
Funky Politics.
Welcome back to the Chairman's Perspective. I'm Mark Billingsley, Chairman of the Shelby County Board of Commissioners, and today I've got a dear friend with us, Dr. Altha Stewart. She is Senior Associate Dean for Community Health Engagement at the University of Tennessee Health Science Center. She is also the former president of the American Psychiatric Association. This is part 2 of a series called Mental Health and Coping During COVID-19. Thank you again, Dr. Stewart, for being back with us during this crisis. We've talked a lot about stress during the crisis. We've talked about older people being at risk, children and teens, and also even people who are responding to COVID-19. We've got so many first responders out there, policemen, firemen, nurses, physicians that you work with every day. Let's just talk a minute about those first responders that are on the front lines. What are you seeing in terms of their stress levels? I know each and every day they face crises every day. Every time a policeman pulls a car over, every time a firefighter is on the way to a fire, and also our trauma surgeons and our regular physicians that deal with healthcare crises. But it is different now. With COVID-19, there's some additional stressors. How do those first line responders deal with this situation right now?
Well, you're absolutely right. This is a different kind of crisis for the first responders. Typically, a fireman knows he's going to a fire. A police officer knows they're pulling someone over and there's some unknowns. A surgeon knows that no matter what you do, you can't account for everything that might happen. But with this, there are often no signs that indicate that you are walking into the crisis. And so it is anxiety provoking, but these are folks who got into their work because they want to help people. And so they're going to do it. And our job, I think, is to be available to them, to recognize that this has got to be stressful in ways that they may never have experienced before, and that we should be prepared to work with them, talk to them, comfort them, work through some of their anxiety, understand that if they really are challenged in doing this, that we shouldn't put them out there on the front line to do it, because that's not good for them or the people they're trying to help.
You know, it's a little bit different, like you say. This is different because I'm a former reserve police officer. You know, you have your own stresses when you're pulling a car over, or when you're responding to a domestic violence situation, for example. But when you're in the middle of that crisis, a fireman fighting a fire or a policeman pulling over a speeder, you certainly are concerned about your own safety, but you're not typically worried at the exact same time about those loved ones who are at home who may be facing the coronavirus. So it is different.
It is very different. And, you know, in the example that you used, police officer pulls someone over, they give them the ticket, they move on. We're not talking violent crime or gun crime or anything, just a traffic stop. And you don't know that the person may be carrying the coronavirus.
Right.
And so you give them the ticket, whatever the interaction is, they cough or sneeze or something, or touch. You touch the side of the car that they've touched, or what seemingly innocent act that has now become the vehicle which will transmit that to you and you to others, including your loved ones at home. And that's just a big unknown risk that is just starting to hit in a very significant way the minds and actions of people. And we're not really sure in the mental health field, we're not really sure how that's going to play out. All we know is that we have to be prepared to work with people who have these fears and anxieties. We've got to help them understand what they can and cannot control. And if it gets to be too overwhelming, we have to help them figure out how they don't need to do that right now, because it puts them in jeopardy. If I'm worried that touching something is going to lead to me
Right.
taking it home to my mother,
Right.
I'm going to be less willing to be that fully engaged. I think it is commendable that the law enforcement here locally has decided to use their discretion
They are.
in how they are interacting and who they are charging. I think that is very helpful from a public health standpoint and does not necessarily compromise public safety, because I think our law enforcement officers do have a good sense of what they should and shouldn't see as serious and necessary for contact.
Wow. As we talk again about the responders, and again, we'll move on to some other topics, but them identifying that they are fatigued physically and mentally, it's okay. And I'm just going back to some things you've taught me over the years. It's okay to say, hey, I need some help right now. Do you think that as a county we are equipped to deal with this many people and with stress and coping during this crisis? Typically we struggle during ordinary days, but this is really different. What are some things that you and I can do with our family members, our neighbors, even when we see a first responder? What are some of the things we can do to be a part of the solution?
Well, I think what you just said, I think recognizing the difficult situation that they're in, we thank our servicemen for their service.
Right.
We need to start thanking these folks for continuing to be out there on the front line in the face of the invisible enemy that they can't run away from. We need to help them understand that it's okay to say, that's the new tagline for me, it's okay to say I need help. I'm not handling this well. I'm worried about my own health or my family's. I need to talk with someone.
And we don't
it's
tend
okay.
And we don't tend to do that very well.
No, we don't. We don't. And we in the course of their training, they don't tend to get permission to say that. And I think during crises like this is when we need to be very encouraging of their leadership to acknowledge that this is different from just about anything we've ever seen, and we have to change the rules. It is okay to say, I am worried, I am concerned, I am afraid. I have small kids at home. I take care of my mother-in-law. We've got these conditions and circumstances and criteria that we are using to try to parse out who doesn't have to do or who. But I don't know that we've taken it as far as law enforcement, public officials who are required to stay on the job no matter what, the folks who are cleaning. How do we handle those things using the old rules? We don't handle them well. So we've got to start looking for new ways of dealing with these things. And we've got to maximize our ability as good citizens to say to people, thank you for continuing to go out there every day. Every time I would fly into the airport,
Sure.
you'd hear someone saying, thank you for your service.
Absolutely.
Thank you for your service.
Absolutely.
The next time you pass a police officer or a fireman or anybody who's on the front lines, the doctor, the nurse at the hospital, thank you for your service.
And we're going to be right back on the Chairman's Perspective.
The Chairman's Perspective on the KUDZUKIAN Network. R&R on Sports.
Pitcher, left-hander, Vita Blue. Welcome to R&R on Sports.
Thank you very much. I'm glad to be on. Let's get it on, man. Let's talk to
That's
baseball.
right.
Talk to sports.
It's R&R on Sports.
And we're back with Dr. Alpha Stewart, Senior Associate Dean for Community Health and Engagement at the University of Tennessee Health Science Center. We're talking about mental health and coping during COVID-19. Let's head on a couple points that we haven't discussed so far.
Well, I think it's important that for people, whether you're self-isolating or working from home, there are a couple of things that we recommend that people do in those circumstances. We're typically home for a weekend, a long weekend, and we're just kind of hanging out. When you're there and the likelihood is that you're going to be there for an extended period of time, it's important to maintain some form of a regular routine. You shouldn't just get up and kind of move through the day. There ought to be purpose in your movement through the day. For people who are working from home, that purpose may include regularly scheduled times to meet with coworkers on the internet or through Zoom or Skype, regular conference calls, regular email timing for either sending or replying, but maintain some form of a regular schedule. And remember always that you shouldn't just sit all day. You need to be up and exercising or active or walking or something. You can walk inside, you can exercise inside, you can flip on the TV or the computer and go through a 15 or 20 minute exercise regimen. If you do yoga or meditation, build that into your schedule so that your mind gets a rest and you rejuvenate and you connect with the fact that you are not alone. Part of the problem that people have with self-isolation, especially those who live alone, is that you reduce the level of interaction you have with other people, and that can be challenging psychologically. So we encourage people to maintain some kind of social contact. For people who are big with Facebook and Instagram and Twitter and all of that stuff, you can do it that way and stay in touch with people. Or you can use your FaceTime, Skype, Zoom things to stay in touch with people. Don't isolate yourself because you're isolated at home. Message.
Does it make any sense, Dr. Stewart? I've only had limited opportunities to work from home, and over the years they've only tended to be like during a snowstorm or very rarely. But when I have, I don't think people appreciate if you really are a little bit of a type A personality, you tend to work harder from home because, at least for me, I feel like an extra responsibility. When I've worked from home, it made more sense for me to get in the shower, to get dressed, to go sit down at my computer. I didn't operate very well sitting in my pajamas. I almost had to turn a switch on like I was going to work. Except I walked into my extra room we have in our house. We have a little computer and an office. Does that seem to make sense for people when you sort of... For some reason, I don't do very well sitting in pajamas behind my computer.
And I think the research suggests that for people who primarily are home-based employed, that's the routine they follow. It does not help that your mind is saying I'm working, but everything else around you is saying you're home. Those two have to be in sync. So getting up, doing your morning routine, sitting down as if you were sitting at your desk in your office. And I think this is especially important for people for whom this working from home may be a new experience. Because if you're locked into, I go to my office and that's where I work, and when I'm home, I'm not working. Now you have to shift gears, and it can be a little challenging, but it is not impossible.
Any advice? Because there's so many people right now that are going to be working from home for maybe weeks. They've got their kids at home, they've got their pets, they've got lots of disturbances. Any suggestions on how you work from home, but sort of create some barriers to that stress? How do you deal with the kids that are running around the house? I mean, does everybody need to go into somewhat of a schedule?
That's the purpose of everybody has a routine. It's not just a free-for-all. The kids have to know that mom or dad are working. And during work hours, there are not these opportunities to do the things they want to do. That we build the schedule so that there's time for work, there's time to spend with them, because they are going to need your attention. But when you're working, they should be in school, at their computer or at the whatever, however they're doing it, or reading or writing a paper or whatever, that you it's like schedule sharing that you would do it at work. That everybody is going to be doing something. It's just that my something is here and your something is there. And then when you're done and I'm done, then we do something together. And you build that in. That way they anticipate that their time is coming, so they're not anxious about, is it my turn? Is it my turn to spend time with you? It also cuts down on the amount of stress for the parent, because you can hear most of the times that something's going on.
Sure.
But you can't just jump up from your Zoom meeting with your boss
Right.
and say, excuse me, I got to go check on whether my kids are killing each other.
Right.
That doesn't bode well. So kids have to understand that's that conversation that you have about this is a different time. And I know it's challenging, but we can get through this. I'm going to need you, though. Even the younger kids understand this is not my time with mom. My time with mom comes when the clock goes like this. That's when I can go in and interrupt her.
Let's talk about this for a second. We have a lot of universities that have sent children back home. They're young adults. They feel like they're adults, but they're coming back to mom and dad. They've been a semester or two away from school, away from home at school. Now they're coming home. They've been not used to mom and dad's rules. How do you deal with a college student, and how does the college student deal with the parent who've enjoyed a little bit of being away from each other, but suddenly they're injected in, they're also in the home full time? We've only got about 2 minutes on this, but tell me what we do.
Conversation. Rules,
Okay.
ground rules. I know you're used to being out there on your own. I supported your being an independent, autonomous young adult, but this is still our house.
Okay.
And there are things that we don't allow, and I'm not going to ask you what you were doing up there that I might not have approved of. But and the other challenge in that situation is if I'm the older child who went off to college, I was happy to get away from my younger siblings.
Sure.
Now I'm back at home. They're there. Mom's working from home, so I'm the default babysitter, and I don't like that.
Okay.
Those are conversations. Those are rules of the house that have got to be established to keep order and peace in the house.
So a lot of what you've talked about is around communication.
Discussion,
You've got to communicate, be honest with each other, and communicate.
Yeah, age-appropriate education about the impact of the virus and the crisis around that. Age-appropriate conversation about the importance of what you can and cannot do. I know we're all in the house together today, but mommy's actually working.
Got it.
Conversation.
Got it. We're going to be right back. We're talking mental health and coping during COVID-19. We're with Dr. Alpha Stewart, who is the Senior Associate Dean for Community Health Engagement at UT Health Science Center. She's also the former president of the American Psychiatric Association. We're going to be back on this critically important topic in just a moment.
The Chairman's Perspective on the KUDZUKIAN Network.
Entrepreneurs should check out Grindset because these are the stories of entrepreneurs told in the most raw, unassuming, and honest ways. And every episode, you will hear things that you didn't know that will no longer scare you, and you will feel encouraged to take your entrepreneurial journey because these are entrepreneurial heroes, and they'll show you the way.
We're back on the Chairman's Perspective. We're with Dr. Alpha Stewart, and today we're talking about mental health and coping during COVID-19. In this last segment, Dr. Stewart, let's talk again about the basics. The basics right now to prevent the coronavirus is washing our hands. I know this sounds ridiculous, but a lot of us do it improperly. Take us through the proper way to wash our hands, because if you watch people in a public restroom, everybody does it differently. But if you talk to a healthcare provider, there really is only one proper way to wash your hands. Can you take us through it?
Yeah, the rule, the 20-second rule really matters.
What does that mean?
That means that you start with wetting your hands, putting on the soap vigorously for 20 seconds, moving your hands in and out through your fingers, back and forth, back and front of your hands, doing all of that, making sure you've gotten under your nails and things, and rinsing. Okay.
Then what do we do?
Then you get a towel and you dry your hands. You don't touch the faucet to turn it off with that clean hand that you've so carefully washed. And you dry your hands and you toss that. You take another towel to turn off the faucet so that you're not transferring either back to your hands or to the sink, to the faucet. And then don't touch the handle on the door. Get a towel to do that. And most restrooms now have a trash can near the door because they recognize that that's an important step, that people have taken great pains to wash their hands carefully and then touch the door handle, the doorknob. That defeats the whole purpose of what we do. And it's important that people practice this. At one point, just like brushing your teeth to the song Happy Birthday, there was a song that people sang.
I remember that.
so that you get into the routine. This is very important in helping children understand it's not just put your hands under the water,
Right.
do this, and you're done. That you make it something that they can understand. Sing a song to washing your hands makes them stay engaged. Just say wash your hands and they'll get in there and do it and touch everything and be gone. And we have to start early with children, especially now, in getting them to understand that that's part of stopping the spread of the virus.
Well, since this can be spread by droplets, not to get too gross today, but let's talk about each one of us sneeze every day. Or at some point you're going to sneeze. What's the proper way to sneeze if you can? What if you don't have a tissue? Can you give us any counsel with that?
The public health officials still say it's best to do it into something and toss it. But in the absence of that, doing it into your elbow, and doing it into your elbow, not your arm, but your elbow.
Okay.
And then making it sure that you don't then walk around touching that and transferring it that way.
And a lot of healthcare experts are saying, do not touch your face.
Do not touch your face. I have been trying to count the number of times that I inadvertently touch my face.
Right.
And it is more than I would have imagined before this all started. So I have adopted for myself the practice of my dominant hand is what I use to touch things that I want to be careful with.
Okay.
And this hand, my non-dominant hand, opening doors, car doors or things, if I can't find anything else, this is the hand I use because I know I'm not going to automatically do this. I may do this.
It makes
because
a lot
this
of
is,
sense.
and that just works for me. And then I know that the first thing I do, whether I'm getting in the car, getting out of the car, getting into my office, is I wash this or Purell it or sanitize
Right.
it somehow or wipe it so that I'm not automatically transferring. It has been the safeguard that I've used over the last week or so as we've gotten more and more involved in our understanding of the virus. It's not perfect, but it works for me.
And again, lots of us, you and I meet lots of people each and every day. We're very blessed to have careers where we interact with the public. We have lots of relationships in our respective jobs. But again, the simple gesture that I think I've really had to break myself of, because I'm a handshaker. If I see you in the grocery, at church, I'm going to shake your hand. But I've really had to pull my hand back. When I've been in groups, I've literally taken my hands and put them in my pockets because it takes a little bit of practice if you're an extrovert, which I am a little bit, not using your hands.
Not using your hand. And I heard Dr. Fauci talking, being interviewed about the elbow bump and everything, and he said, look, if you really want to show that you care about having, seeing someone, just touch your heart and say,
what a great gesture. What a great gesture.
So I've started doing that.
We've talked about working from home. Any other thoughts about just self-isolation, Dr. Stewart? Anything we've got to... Yeah, I'll just very quickly share a story. My son is now doing his schoolwork from a laptop. He's very fortunate. He has an instructor and his classmates. He can see them. It's a new norm for them. They're getting used to it. But I thought what was really interesting was at lunchtime, when he would typically have gone to the cafeteria at school, he created his own little group of people on the computer that he typically has lunch with every day at his high school. And they literally on the laptop got together with like a little group. They ate sandwiches together. They talked and joked in between class. They're used to doing that in the cafeteria, but they did it online. I think that gave my son Connor and his classmates a little break. Tell me how important it is in this last segment about how we continue to try to interact and see each other, feel each other, and understand we're going through this together.
I think that is such a wonderful example of how to draw our old normal into the new normal.
Okay.
If they ate lunch together and that was sort of the lunch crew, doing it virtually may not be as much fun as having the face-to-face interaction, but it's the group. It's what they normally do, and it allows them to have that moment of, this is how we do it. And that's a new way to do it. I would encourage people to follow that model. If you have things that you normally do, eat dinner together or go out, set it up as a virtual thing and do it anyway, except do it via the internet. It allows people not to isolate socially while they are isolating for health.
I know a lot of people listening to this may not be whizzes at the computer. They may not be used to that. They may be retired. But now, if you do have a computer in your home, it's really easy to interact with each other and actually see each other. And we're seeing a lot of that. So I'm just going to pick on a couple groups. If you're in a support group, if you're in Alcoholics Anonymous, Narcotics Anonymous, if you've got a Sunday school group and you've met for the last 40 years, you can still do that via your computer. And there's nothing wrong with the phone. I think a lot of younger people especially forgot to learn how to use the phone to speak. But I think from what I've learned from the show today in parts 1 and part 2 of this series, the more we can interact, even over the phone, to say, hey, Dr. Stewart, how are you feeling today? That means something, and it's going to help each other.
And it's especially important with people who have chronic illnesses, people who are elderly, people who are alone and don't have family in the vicinity. They're used to having some level of social interaction with someone. If we all are isolated because we don't want to pass this on, they don't have anybody. So we've got to extend ourselves safely, but we've got to extend ourselves to help our neighbor in this time of need.
Dr. Stewart, Dr. Althea Stewart, Senior Associate Dean for the Community Health Engagement at UT Health Science Center, you've helped us so much today with mental health and coping during COVID-19. We'll have you back on. I wish you a happy and healthy rest of the week, and I'll see you soon.
Thank you. You as well.
Thank you.
Jazz, America's own original musical art form. When did it start? Who were and are some of the major players? How do you distinguish what kind of jazz you're listening to? We talk about the great and lesser-known artists, songs and tunes, the instruments, and the social impact jazz has had on world culture since its beginning at the start of the 20th century.
Riffin' on Jazz on the KUDZUKIAN Network. KUDZUKIAN!
I want to thank you for tuning into the Chairman's Perspective. Today has been a real blessing to have Dr. Althea Stewart with us. We've talked about mental health and coping during COVID-19. I think if I've learned anything today is we're all in this together. We can help each other. Even if we can't get together in person, we can reach out by picking up the phone and calling a friend or neighbor. We could continue to meet. We can still have our Sunday school class online if we want to, or we could have that same Sunday school class by calling a friend and just sharing a kind word. Again, thank you for listening to the Chairman's Perspective. We'll be back with more useful information in the days ahead.
The Chairman's Perspective Podcast. Executive producer Shelby County Commission's Chairman Mark Billingsley. Directed, produced, recorded, and distributed by KUDZUKIAN.